Single arch dentures with the DENTCA system. In addition to doing sets of complete dentures, you can also make high-quality CAD/CAM dentures for a single arch with just a slight modification to the procedure. In your DENTCA kit, you will find a gray uni attachment that adapts to the opposing arch for a single arch denture. This can be used on the upper or the lower. We will review step by step a case for a single upper denture opposing lower natural teeth. This patient presented with a denture that had been delivered immediately after extractions. With some resorption, the denture no longer fit well, and she felt her teeth were too big and white on her current upper denture. As with a complete upper and lower denture, we will first establish vertical dimension of occlusion and lip length. Next, we need to get our impression. For the opposing arch, in this case the lower, we will make a traditional impression. You can either pour an alginate and send the stone model to DENTCA, or take a polyvinyl siloxane impression of the lower arch or opposing arch for DENTCA to pour. Once you've selected your appropriate tray, you're ready to take your final DENTCA impression. Note the finger rests that you will utilize to stabilize the tray during border molding. The flat striking plate in the center of the upper tray will be used to capture VDO and CR. Load the tray with heavy body polyvinyl siloxane with careful attention to cover all borders. This impression will act as a custom tray, which allows the light body in the second phase to capture the fine details of the patient's soft tissue anatomy. Border molding is completed at both stages with a heavy body and light body polyvinyl siloxane. After border molding, evaluate your impression and identify any areas of tray show-through. If the tray impinges, it will cause a high spot in the final. Relieve these areas with an acrylic burr like an E-cutter or a pear-shaped burr on a straight sleeve handpiece. These areas will be filled in with light body, so don't worry too much about over-reducing. It's more of a concern if you under-reduce, as it may result in further tray impingement. Repeat the steps with light body polyvinyl siloxane. Make sure you fully cover the heavy body with careful attention to cover all borders and repeat your border molding steps. After removing your tray, evaluate that all the landmarks are captured and cut the distal portion off of your impression and separate carefully. DENTCA has both upper and lower attachments for dentate opposing arches. The lower attachment has a pin and the upper arch attachment has a striking plate, similar to the corresponding edentulous trays. Load your single arch attachment with a rigid bite registration paste of your choice and place it against your dentate opposing arch, allowing the material to fully set. You will want to use enough material to maintain stability throughout your jaw tracing. If your opposing is a lower, as in this case, place the pin into the uni arch attachment rounded side up. If your opposing is an upper, wipe the plate with alcohol and apply the Easy Tracer, sticky side down. If your edentulous arch is a lower, you will place the pin into your impression tray and seat in the mouth against the upper uni arch tray attachment. If your edentulous is an upper, as in our case, you will apply the Easy Tracer to the upper arch and seat in the mouth, opposing the lower tray attachment. The Easy Tracer film peels back and it will clear the previous trace, so you can try as many times as you like to trace the centric relation. Have the patient move forward and backward, left and right slowly, and repeat a few times. If done correctly, you will see a clearly defined arrow. If your tracing does not look like an arrow, peel back the film and repeat. For some patients with a difficult centric relation, it helps to recline the patient. When a patient is lying back, the stabilization muscles tend to relax and make it easier to seat the patient in centric relation. Whether a single arch attachment or an edentulous tray, capturing an accurate centric relation is critical. Make sure that you are happy with your CR tracing before proceeding to the next step. If your CR is incorrect, it can result in an open bite, an open vertical dimension occlusion, or other bite issues. This is one of the most common errors we see in complete dentures in general, as well as with DENTCA dentures. Once you're happy with your centric relation record, drill a dimple at the point of your centric relation. This will help provide a stopping point for your bite. Have the patient practice sliding back and forth at this point so that they can have the tactile sensation of capturing centric relation. Stabilize the mandible with a thumb on the tray or attachment and your fingers under the chin while you inject your bite material. Verify your midline if desired, and remove the tray, the bite, and attachment assembly from the patient's mouth. You will ship this to DENTCA along with the opposing model or impression and the cut saddle pieces. You will ship this to DENTCA along with the opposing model or impression and the cut saddles. At this point, DENTCA will design and fabricate your denture. The opposing model will be scanned in, and the ideal setup will be designed to match the opposing dentition. As with a complete upper and lower, you can proceed with your trial denture or your final denture. Since it is not opposing an ideal digital occlusal plane, and since a digital occlusal plane would provide a more ideal scan than a stone model, be aware that a single DENTCA denture may require more occlusal adjustment than a complete set of DENTCA dentures. Follow up with your DENTCA denture patient as you would any traditional single denture patient.